I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
All right, good morning, Dr. Lebowitz, Long Island Gynecomastia Center. Busy week we had. This is the end of the week. I don't really work on Fridays, or I try not to. Today we have two cases. The first, they're both Vaser, high definition lipo. First case is like a redo. Second case is a big guy that we're doing the whole thing. So this young man is a redo, but not by me. He's from Philadelphia. He had surgery done a couple years ago in Philly. He had lipo and gland removal. You can see, again, this was not by me, but he had the incision here. You can kind of see the lipo mark on this side and, you know, mirrored on this side right there, and also the incision by the nipple. So he's had lipo, not the way I do it, and he's had gland removal. So when he lifts up here, the glands are gone. There's kind of an empty space here. But you know, he's got this fat going on here, and really this is just fat. I'm going to explore underneath there, make sure that the glands are gone and everything's perfect, but I do not want to cause an indentation. I want to maintain some athletic shape there, but he needs this kind of vasored and tightened, no abdomen, and no J plasma today because he just doesn't need it, and keep the cost down and everything for him. So I'm going to define the pectoralis major muscle. That's kind of really what I'm doing. Tighten up the skin with Vaser. Stealth incisions, of course, here, not here, here, and one by the nipple. Get down to the belly a little bit. You know, I want to create a little bit of a shape there, but really define the pectoralis major muscle and get rid of this stuff to give him that great hockey stick boomerang shape. Local anesthesia, of course, and guaranteed results, of course. So I'm going to mark them and numb them, and here we go. So I really want to scoop this out nicely, really empty the space from the lateral aspect of the pectoralis major muscle here, the inferior, really get that boomerang hockey shape and really get this really down to rib cage and define the lats back here. I want to go back here also because through my stealth incision I can really almost get to the back here, really turn around here. I can get here also and really scoop this out nicely. Get this nice definition here. The upper six pack, suck in your belly. You can kind of see in my curved cannulas, I can get down here also, give him a little bit of an indentation here. The linea alba, the semilunaris, and don't go the deltopectoral groove. I'm going to stop doing that, I think, because I want to maintain volume here. I just kind of thought that out and just kind of want to maintain volume, but really get here, the upper six pack, the pectoralis major muscle, and just define him and hockey stick him so he looks just athletic and perfect. And by no means is he bad in the world of gynecomastia at all. Stealth incisions, of course, in the armpit by here, and I'm going to numb them in these areas. I'm going to pump them up as you usually see, and we're going to do them up. And we're going to pump you up.
To pump you up.
So what we're going to do is I'm through my stealth incisions, through my ports, and I am going in there. It's a redo from lipo and gland removal. So there's a little more scarring here from that, but I'm melting. Let's get that up there, good. So I'm melting the gland and really hugging the edge of the pectoralis major muscle and the ribs going laterally to define him in this way that I really want to. The old incision that the doctor in Philly did, no fuego. No fuego? No, that's fire.
No bueno.
No bueno.
Bueno.
Because the energy comes from the tip. I'm not going to say anything dirty about that. But, and I'm taking my thumb and I'm pushing at that tip to actually etch the edge of the muscle. All right, so now we suck you out.
We're here to suck you out.
So I remarked them, and I'm getting the lateral edge of the pectoralis major muscle here, really scoping that out. Really sculpting this out and going to the back. How about that? So why do an incision here? That's like, duh. I got my curved cannulas. My cannulas with Peyronie's disease.
What's that?
It's a curve.
You don't know.
Well, they got commercials on it now.
Google it.
Yeah, they got, you know.
Pepperoni.
I like Peyronie's with cheese in them.
The cheese. Dr. Lebowitz, Long Island Gynecomastia Center, just finished a beautiful job, a revision, a touch-up, whatever you want to call it, on this young man. Came all the way, hey, when that happens, hours, from Philadelphia. He had, a couple years ago, the liposuction through the standard silly incisions down over there. He did remove the gland, and the doctor did do a good job on removing the gland, but he did just liposuction to flatten them out, not anatomical liposuction. I did the stealth incisions here, did a beautiful job between the lateral pectoralis and the inferior pectoralis down to the lats, down to the upper abdomen, did this midline here, do an abdominal vacuum. Look at that nice shape here. Did the upper six-pack. He'll work on the lower one. Maybe one day he'll come back and I'll do a six-pack on him, or the four-pack and down here if he wants. But look at this shape. This is just absolutely insane, like Crazy Eddie. But look at this shape there. I mean, this, do I need to tell you more? Beautiful shape here, the upper six-pack here, the pecs, athletic, masculine, lifted, defined, revealed, etched, and contoured. Amazing. Again, stealth incisions. No stupid incisions over here. That's so yesterday. You need me, you call me, Dr. Lebowitz, 631-424-0101, 631-424-0101, or email me at email at me at, what's my email? JonathanLebowitzMD@gmail.com. And this is the fact that I got out, just by the way. You got me, you need me, call me, I will respond, and I will make you as amazing as me.